Hello to all. Welcome again to one more session of Day Life in podcast. I'll give a brief introduction of what Day Life in is. So, DLife.in was founded in 2014 by the brilliant and very dynamic Anup Singh, an engineer and a silver medalist from India's distinguished IIT Roorkee. Anup is also a type 2 diabetic from 2011 and when diagnosed with diabetes, he completely changed the game by going low carb and is still living pill-free life. It was Anup who pioneered and came up with the idea of restricting the carbohydrates to 100 grams a day, possibly as the upper limit as a low carb diet, specifically in the Indian scenario. What Anup has done for the diabetic in India has never been thought of or achieved by anyone else before. Now, DLF has more than 2000 plus combined success stories of diabetes, hypertension, weight loss, fatty liver remission, among many other disorders. And now we also have more than 1,200 Indian low carb or keto recipes on the forum. In in 2021, Anup and DLife was awarded the coveted Icons of India Award by the Outlook Group. What started off as a community in 2014 has now become the biggest and fastest growing low carb platform in India. So DLF's diploma course that was launched in April 2020 has given India its top of the line low carb nutritionists and metabolic health coaches. The DLFN diploma is the most exhaustive low carb nutrition course in India and the only one which focuses on metabolic disease remission via low carb nutrition intervention. So DLife diploma is the most sought after course in low carb, not only in India, but also now in abroad in countries like Australia, France, Guyana, Nepal, among others. So I'm a proud member to be of the DLife, to be a member of this coveted in India's only award-winning low carb community. So I'm Shashikant Iyengar, metabolic health coach. So I'm a SMHP accredited metabolic health practitioner in India and doing independent practice. I have my venture is Loka Metabolic Health India, and me and Anup together we have conducted the first low carb conference in India called Metabolic Health Conference. It was just concluded in the last week of October. So today we have a special guest with us, Dr. Salih Saad Al-Ansari. Dr. Ansari, welcome.
Welcome. Thank you for having me.
So I'll give a brief introduction about Dr. Ansari. So he was an assistant professor, family and community medicine. He's a CEO, Health Promotion Center, Riyadh, Saudi Arabia. As far as academic degrees are concerned, in 1994, he has done family and community medicine from King Faisal University, Dammam, Saudi. 1987, bachelor's degree medicine, King Abdul Aziz University, Jeddah, Saudi. So Dr. Ansari has an academic as well as practical background. He was appointed as a supervisor of postgraduate program for family medicine. Then he was appointed as the Director General of School Health, Minister of Education for 10 years. Later on, he was an assistant professor in family and community medicine in King Saud University for Health Sciences at the KFM campus and as a dean of Ghad Health Sciences College. Dr. Ansari is an advocate in health promotion and combating NCDs in the Arab Gulf state and Saudi Arabia since more than 28 years. He also written two books in Arabic on walking and wrote and translated more than 200 articles on walking, nutrition, health promotion, and how to deal with NCDs. Since the start, Dr. Ansari always looked at NCD as a complex metabolic derangement that is hitting Saudi Arabia, Gulf, and the Arab region as fast developing countries that has changed his lifestyle into a sedentary one and highly dependent on the processed foods, which are also high in carb and energy dense foods. Dr. Ansari is active on social media in Twitter X, YouTube, Instagram, WhatsApp, Kik, Snapchat, and Facebook to promote walking regularly and motivate the Arab speaking community to readdress NCDs as a lifestyle related health problem. He gives great emphasis on the holistic approach in dealing with NCDs for both individual and the public. He has documented and published more than 70 stories on remission of different NCD cases through intermittent fasting, low carb, sleep, walking regularly, and related lifestyle changes. So we can see that while uh, in our community we generally talk about low carb, but Dr. Ansari, on what he has done is he has incorporated a holistic approach,
Hmm.
incorporated exercise in very simple form, very simple form of walking and intermittent fasting. I think intermittent fasting is there traditionally. It is there in all the communities across the globe. So, so Dr. Ansari, it was very interesting to know all about you. We can start with discussing what is the situation of metabolic syndrome in your country and around you in the Gulf state, in the Arab state generally. We read that the incidence of all these NCDs are very high. So can you throw some light on
Mm,
obesity, on diabetes, maybe cardiovascular disease? How is it there?
yes. Shashi, I'm very happy to be with you. I enjoyed your great conference. Recently, I attended each and every lecture online, of course, and really admiring what you are doing in India and the whole region. For my story, I will let you know my concern about NCDs in the region. When I remember when I was a fourth year medical student, we were in a debate among ourselves to know about what is the prevalence of diabetes in Saudi Arabia. And that almost 35 years back. We were in a debate. Is it 4% or 6%? That's why not too far away, not far in the history. It was only 35 years, something like that. Now we are talking about something like, of course, it will depend on the criteria and the diagnostic criteria to include, but we can talk about something between 20 to 30%. Another fact is that diabetes over the last 30 years was increasing by 1% every year, which is too much. The other issue that we need to know not only the prevalence, but we want to know how is the acceleration going, whether it is reducing the numbers or we are doing what we can do to do it, or we are plateauing around 30, 31, something like that percent of the population, or unfortunately, what I'm afraid of that we are escalating, and these numbers are unfortunately growing. And it is not only diabetes; it is a whole complex. And anyone who has diabetes probably is subjected to hypertension or to coronary artery disease. In the same time, he could be overweight or having the whole complex, and uh, these problems are not addressed very well in our healthcare services until now, because the orientation and everyone is talking about the curative aspect of NCDs. What can we do? How much drugs we can offer to the people? How to treat and how to, and unfortunately, this is not well addressed even in the teaching colleges, where we are taught from the moment that the patient comes to the clinic or to emergency, and from there we can start. But sometime earlier, what was happening with that patient, this is the issue. And these numbers, unfortunately, are, people are thinking that someone will be having diabetes, not me. Someone will be having coronary artery disease, not me, because I am fortunate, I am lucky. And to tell you why I am very much deep in this issue, to tell you that me and my siblings, and nine of our family, are unfortunately all of them are diabetic. All of my 9 siblings are diabetic. the one who are older than me and the ones who are younger than me. The youngest is something like 40, 42 years in age now, and all of them are diabetic, unfortunately. And this is repeatedly done and repeatedly seen on almost every Saudi or Arabic family. At least one or two family member who is above 40 is having diabetes. And this gives us a clue. And Alhamdulillah, I was not diagnosed to have diabetes at any moment in my time, but I got the signal. And I am calling myself the only one who was saved from this any things that is happening to almost everyone at my age. And from this point, I was thinking as a doctor, is it enough for me to sit as a family physician and wait for patients to come and to diagnose and to do medications or drugs? And from my training, I was trained in family and community medicine. We had almost 6 years of postgraduate where we had something like 60% of our training on family medicine and 40% on community medicine, where we need to go to the public, to go outside, to see what is happening, to look into not only the tip of the iceberg, but the hidden part of the iceberg. From there, I couldn't agree on going for clinical care alone, but I added doing what can I do to prevent. And Alhamdulillah, I had the chance to serve my country as a Director General for school health for almost 10 years. At that point, I was only want my country to be sure that the students who got into school at 6 years of age is graduated at 18 years with a good weight, good habits, not smoking, slim, active, having good lifestyle. And this is a great chance to do a lot of things through schools, because I remember one of the books I read, it says that all what I know in my life, I knew in my 6 years of age, where we need to build the habit. And it is a great chance to start at earlier age to build in all these good habits for people. And I might say, I don't think that curing those who are coming to the hospitals are enough to tackle a great problem which is escalating and getting greater dimensions.
Very interesting that other than the curative, you have gone into prevention at the school level, and I think that is very, very important that school children are actually educated on the right lifestyle practices.
I
So that
remember
they do.
when I was in school health, we banned soft drinks
Great.
in all Saudi schools for girls and boys, the same. And it is until now. I think it was since 1998. Until now, soft drinks are banned from all Saudi. But we need to do something outside the school, of course. But
Yeah.
this is a message.
Quite good. I've been reading that the incidence of diabetes there is, as you said, 22 to 30, or possibly like 28% is what we read. Even in India, the prevalence is 11%. Whereas the level of obesity over there in Saudi possibly could be as high as 60% is what I read, possibly, and very high incidence of coronary artery disease, cardiovascular disease also. I'm very curious to know, okay, what is the reason why this is happening?
To myself, I think that we have to look into what has happened in our country over the last 40 years. As I mentioned, it was something like 4% for the diabetics in Saudi Arabia. Of course, many things has happened, but I trying to attribute to the main problems. The first problem is low physical activity. And over more than 40 or 50 years, we have imported millions and millions of cars into our country, because our country has grown very fast. I remember the rural areas that I was living in when I was born, and now I no more see any rural people living in any rural country. Nothing can be called rural nowadays. In that time, and to let you know what is happening, the private car is the main mode of transport for almost each and every Saudi people. And to make it clear for you, in my household, we are owning 9 cars for myself, for the driver, for my daughter, my wife, and 3 of my sons, who is having one for the roads and another car for off-road. And you can talk about 8 cars in one household. In such a community, it is very difficult to convince people to leave the car, go out of the car and walk. This is the first reason. The second reason is, of course, not only walking, but doing any physical activity. And then just to extend, I remember almost around 14 years back, I saw one of the national studies that describes the physical activity in Saudi Arabia almost 15 years back. And they try to know what sort of physical activity Saudi people are doing. And at that study, as far as I remember, number one mode or number one physical activity is going to the gym. And at that time, I didn't like it, because who is going to the gym? You will find a few people, educated, have enough resources. And how about the others? I didn't find any good physical activity to convince people other than walking, which is very cheap, possible for everybody. And it doesn't need any training, no team, no machines, nothing. And I wrote one of my articles about walking. I mentioned something like 27 reasons why we choose walking to convince people to do physical activity. On the other side, it is processed food. We are importing almost 96% of our food from outside. And if it is imported, it has to be processed somehow, whether it is raw, like rice, again, it will be processed. Wheat could be processed. And if it is packaged, again. And when you look at the consumption of Saudis for sugar, as far as I remember, it is almost 2.5 double, more 2.5 the required amounts of sugar or allowed daily allowance of sugar. And it is everywhere in processed food, in ketchup, in a lot of things. And in our case, it is now nobody is shopping in the nearby market. Almost everybody is going to the shopping mall, where everything is there and almost everything is imported, and almost 70 to 75% of all the packaged food is processed. You can add to this that really people got addicted to sugar. When you look into our country, you will find a lot of people or shops are selling desserts, sweets, all these highly processed wheat and highly processed flour that is turned into a nice looking sort of cakes and tiramisu. You can mention, and you can name. These two issues are very important. One more issue is that the availability of food as a whole. Food became very much available compared to what's happening almost 60 years back in my country. Availability itself needs to be joined with some awareness, some understanding of what we eat, when we eat, how to eat, and the amount and these things. And this one, and in my view, that the medical care has very much concentration on curing people, not to educate people, not to be sick. And here we can look into what are the efforts are put that were put into educating people, in the same time as we allow all these sort of packaged food and processed food to get into the country. I see that there is a mismatch between availability and awareness, and this is what we are trying to do, which is physical education and physical activity, and educating people about walking and physical activity, and trying to reduce the amount, or the at least the processed food or sugars in the consumption. And these are the main reasons I need to concentrate on.
Fine. So it is, one is the sedentary lifestyle, not exercising, the availability of processed food, and the third was the overall availability of the excess
All
food,
sorts.
and people are not able to really cope up with what our ancestral way of eating was, probably because it will
Yes.
lead to additional snacking, additional calories will go in, and that too processed calories is what we
And
see.
you need to add, of course, sleep hygiene,
Hmm.
sleep problems. I need to add, of course, stress management. You need to add other issues. But in myself, when you have a very limited resources, try to find the big enemies,
Hmm.
2 or 3 at most. Then
Yeah.
try to spread yourself thin on doing almost every aspect of lifestyle. In my case, I think it is the availability and the amount of food you are
Food
taking
we
and the
take.
processing, as well as physical activity.
I think that is how the Pareto principle also works, that you
Uh,
focus on few things which will give you the maximum impact. And I think that's what you are
exactly.
currently doing this. And there is one controversial question I want to ask is, especially in India, that the concept of vegetarianism is too much. And people keep telling that all red meat eating countries are having high diabetes incidence. For example, even India, those red meat eating states are having high incidence of diabetes. If you see entire Middle East, the incidence of diabetes is all about 20%, 20, 28. Even if you
Mm,
take our neighboring country, Pakistan, the incidence of very high, more than 20%.
more than.
Is it that eating red meat causes diabetes, as they say, as the propaganda says?
Well, the people were convinced that meat and fat are the reason. So still, whenever you go to our any shopping mall, you will find a lots of low fat yogurt, low fat milk, low fat biscuits sometimes, which is not solving the problem. And I don't think that meat is the problem. Of course, it is the processed food. It is the amount of sugar. It is the sedentary lifestyle, and people are now. Let me tell you what was the difference that is really made in our case. It is probably almost everywhere globally. Uh, People used to have their education from one source, which is the main TV, the mainstream uh, media, and now people are starting to hear other voices. People who are coming and showing on YouTube, on Twitter X, on other social media to say something different. And now we can say that we are really starting the comparison, and people will be having the choice to choose among these two schools. People who say that they try to take the least amount of of fat, the least amount of meat, and try to take as much as you can from this, what do you call it, low fat diet and low
Whole grains.
whole grains. And I don't think what is common between yourself and your country and ours is probably again the transportation issue and physical inactivity. And I remember that once I was in China almost 20 years back, and I see a lot of bicycles in China, a lot of bicycles. Now, when I watch TV or like, I don't see much. We might see motorbikes, but no bicycles as was. And probably this was happening in what is happening in India as well. Beside that, the processed food again is there, And because your country is mainly vegetarian, people don't have the courage to take a lot of meats and fat or animal fat. So people are changing this view, but slowly, and we need to give more ideas, more voices, more channels to address the difference between what has been recommended over the last 30, 40 years back and what is really being practiced and your initiatives and the likes.
So I think the the net issue is the high usage of processed food, the 2.5 times higher usage of sugar. And what we have also seen is wherever they are taking meat, they are taking a high amount of refined flour breads or
Mm.
rotis or whatever you may have in your country. And here it is all
Mhm.
refined wheat rotis and tons of rice. We'll have to really search for that meat inside that biryani or something. So if you really see this, the the non-vegetarian stuff or what we call as meat, it is taken with lot of refined foods, and somehow the we don't really pay attention to the refined food. Instead, we blame this. So that's how it goes. Now, coming to the other pivotal question about your initiative. So there are two initiatives which you are doing. Is you already told about walking. There's
Yes.
one more factor which you incorporated is intermittent fasting. So please tell us about these two and how you have used intermittent fasting and walking very effectively in your community to overcome the metabolic disorders.
Me myself is a walking person. I used to walk since more than 32 years, almost every day. And to make it clearer to the others, when they say to me, how did you gain the habit and what do you recommend and why, how can you keep doing this every day? I say to them that I tried to stop walking myself. I couldn't. Because I got addicted to walking almost every day. I used to walk since 3 decades or more, almost every day. I wrote a book on walking and health, and I wrote another book on walking and obesity, how to start a program that takes something like 4 months to take you by walking and adding some lifestyle changes over 4 months to become healthier, thinner, and in a better situation. And in Arabic, I translated more than 200 article on walking, and I showed on a lot of podcasts, media, TV, satellite TVs, to address the issue of walking. And over the last almost 12 years since I started social media, I started to formulate walking groups. And we could formulate almost more than 200 walking group in Saudi Arabia, where they meet every week to walk at least for 1 hour or more, sometimes 2 hours. And they keep showing their work in social media. And the greatest and the biggest group is Riyadh Walkers. Probably you will see this sign for Riyadh Walkers, which is a very big group, which is formulated now, probably maybe approaching something like 2,000 member in Riyadh. And we are, over the last 5 years, splitting into smaller groups that goes in different parts of Riyadh to walk almost every week and propagate the message to the community on walking. And we all, the group, gather in Friday morning to walk for 10 kilometers every Friday. And the last one was last Friday. And another group who used to walk half marathon, 21 kilometer. This group may be something like 20 to 30, 35 people who used to walk 21 kilometers every week, every Saturday. Another issue that I started on 2014, the initiative of called Durub al-Arab, Arabian Treks. Arabian Treks, which is a small initiative that talks about nature walking. And we used to take people to the mountains, to the greenery areas, to the desert, to walking paths that used to be in our country in ancient years by the pilgrims and the caravans and old trails, we call it. And Alhamdulillah, we could do something like 180 walking or nature walking trip. Each and every one is a group with a leader, with a map, with walkie-talkie and safety issues with us to do walking, nature walk. And in the same time, we used to cover our activity in the social media. How long we walking, sometimes we do overnight and continue. And I remember that we were in Al-Ula 2016, as far as I remember. We walked in a weekend for like something like 52 kilometers in Al-Ula. Probably you hear about it nowadays. And now we are talking about a walking community in social media, groups. We used to do training on walking, research to see what is the impact of walking on personal and community sides of the issue. We do some initiatives, walking for diabetes, walking for blood donation, walking for people who are handicapped, walking with your doctor. And a lot of these, of course, we are also adding what we know, the international days on walking, on health, on Parkinson, on other issues. And we also created a lot of content. And I remember on 2012, I translated the what do you call it? Whiteboard film, a whiteboard film that was put by Dr. Mike Evans from Canada. And I translated and voiced over the whole film in Arabic, and it was again put on Mike's channel on YouTube. And by now, I can say that this film was watched by something like 12 million people who saw that film. The film is called 23 Hours and a Half. 23 hours and a half. The film is talking about 23 hours of the day you can sit or sleep or do whatever. You need to save only 30 minutes, half an hour for walking. And the film is very interesting. And we also created a lot of articles, how to choose walking shoes, a lot of content that is describing. And now I can say that we could, alhamdulillah, answer all the common questions people used to ask about walking, when to walk, how to get the habit, and these issues. Alhamdulillah, things are improving. Nowadays, we are trying to make Riyadh walkers into a society. And some of those groups in the one I talked about, 200 groups, by now, 7 of them have been transformed from a walking group into a walking society that is also propagating the message about walking. And alhamdulillah, we did a good homework in our country. And to tell you that the thing are becoming infectious. People in Oman, people in Jordan, people in Egypt, people in Sudan, they got the message and started to communicate with us. Some Arab people who are living in UK, they formulated their own walking groups and started to walk. And now really yesterday we received a guest from Oman who came from Oman to see Riyadh walkers and walk with Riyadh walkers. And this is, alhamdulillah, is booming, and people are hearing the voice. And then I can now talk about what we added to walking is intermittent fasting. I used to listen and see and watch what Dr. Jason Funk is doing on intermittent fasting. And I have been following him almost now for more than 4 years. And I saw almost each and every lecture. We also, I used to watch also Robert Lustig. who is talking about metabolic health, and he used to say, it is not what has been in the food, it is what has been done to the food to make it processed food. And alhamdulillah, we could propagate the message. And probably you can you notice that I attended your conference, the metabolic health conference India, on 2000, the last November, and I translated almost every good aspect of that and main points by each and every speaker to tweet about adding this great lifestyle issue into walking as well, and trying to reduce the processed food, try to reduce sugar, look into low carb, and start uh, intermittent fasting. And I used to say to people that I started with myself almost now 3-4 years. I used to take my lunchbox to the work. I never started the day eating anything. I don't take my breakfast as early as people used to do. I take my breakfast, which is a bit something like brunch. Let's talk it. Let's name it breakfast and lunch in the same time in the office, where I start something like 3 o'clock or 2 to 3 o'clock, and I start to take my lunch. The second meal is around 8 to 9 in the evening with the family for a socialization and coming together. And in the same time, I used to talk about intermittent fasting. I wrote a lot of articles on intermittent fasting. And what I did almost 3 years back, I started a X Twitter account that is talking about walking stories. Walking stories. I collected something like more than 70 stories for people who started with a very few steps of walking, and gradually over 6 to 24 months to take themselves from one point to another, where these stories are talking about diabetes and how to, and people who documented remission of diabetes, of coronary artery disease. People, and just to recall, one of our friends who is used to walk with us 21 kilometers is a close friend of mine who has put an stent in the heart almost 2 years back. And now he could walk 21 kilometers non-stop. And these stories are, every story takes something like 1 or 2 pages in summary to talk about those people. And I remember one of them who said to, one of the stories, it says that, he says that I used to visit my doctor to know about his health. the one who is telling the story, I used to visit my doctor to ask about his health, not my health. Alhamdulillah, my health is now very great. And the other story is called From Insulin to Walking. Okay. People who over 6 months could transform themselves from insulin to non-medications at all, and a lot of walking and low carb and these issues of intermittent fasting, and a lot of stories. And really, in my case, probably even all the Eastern societies, stories are valued. Stories are valued, and people wanted to look into a life champion who did everything and got the message and got the results as he planned. And these stories are spreading, alhamdulillah, like virus in all the social media. And I used to keep doing and keep sending the tweets that I used to tweet almost 4 years back. I do re-send the same tweet now and see how people, and alhamdulillah, there is a great response. And this is beside my clinic. I used to do consultations on low carb, intermittent fasting, walking, lifestyle changes. And in my case, although I am a family physician, I don't like to do much on medications. I used to say to my client, your medications is the responsibility of your curing doctor who is in a hospital. He has the facility, he has everything, but I do the lifestyle changes. I do And I used to say to people, feel free to communicate with me on WhatsApp at any time so that I can support and answer the questions. And unfortunately, doesn't happen in our medical care. And alhamdulillah, things are showing and people are really observing what we are doing. And a lot of my friends, probably one of my friends is Ali Al-Khuzayim. He's a Saudi guy who is joining now in this Zoom podcast. And he is one of those pioneers who used to take insulin. And this was 12 years back, and now he's free of diabetes. And he walks a lot of walking, and he could do a lot of initiatives on propagating the message on NCDs.
Very, very, very nice to hear that just by walking and applying intermittent fasting, that person can really come off medication, that to insulin.
We
What
can,
is
and
your,
just only trying to add the quality of food,
yeah.
and this will be more than enough.
How about what is your experience in pushing people towards low carbohydrate diet? Is it that people are willing to go for low carb, or is it they're primarily sticking to IF, intermittent fasting and walking? How is it?
Wallahi, I have to say that low carb is a bit new concept to the community. Probably it is well known to some of the experienced people. And to make it clearer for you, I want to say that we have our low carb community club, Saudi Low Carb Community Club, which is part of the Saudi Society of Clinical Chemistry. This club was initiated on 2019. 2020, they've made their first conference on low carb. 2023, on the last week, they concluded their second national low carb community conference. And alhamdulillah, they are very well connected to some of the international speakers. As far as I remember, Mr. Kim Mikosker, Dr. Peter Bruckner from Australia. They invited them in person. They joined in Jeddah. And the message is getting spread more and more, but I think it is a bit the concept in our community is relatively so يعني recent. It is not like not as well known as walking, because walking is a historical and sort of the human nature. But low carb is growing in Saudi Arabia. They are covering their activities in the media. They are well supported by the government media. Recently, they signed an agreement with the health sector in Jeddah and Mecca region to incorporate low carb into the clinic in the hospitals as well as the primary healthcare centers. And I think both directions, when the government accept this issue and the community is oriented about it, I think the move will be faster.
I think that's what that's what we have been reading in Twitter X, that they have held a couple of conferences, and even recently they have signed this sort of understanding with the government to propagate low carb, which is really good news. And we never knew all about this. It's only recently, thanks to you, that once we have been following you, we could really see that a lot of things is happening. So earlier we have been reading only that incidence of NCDs are very high, but now we see that there is a ray of hope. You are into walking, intermittent fasting, and probably slowly as you push on this low carb concept, it will go well, because primarily since people are meat eaters, it is going to be a little more easy to incorporate more protein foods and lower down the carbohydrates.
Let me add that our friends, Dr. Abdul Hadi Bima and the group or low carb community, when I came close to them, I was in a very long conversation with Dr. Abdul Hadi. I noticed two issues. One of them is they incorporating not only medical staff into the club, but also people from the low sectors, from the economics, from industry, from pharmaceuticals, from everywhere, so that these people can push with their different expertise other than the health aspect of the issue. The other things is that they are calling loudly for conversation, for negotiation, because I see that there is some sort of resistance for low carb ideas. Abdul Hadi and the group is trying to bring everyone on the table and keep discussing, keep negotiating, keep doing all these, sometimes facing each other, probably fighting somehow our ideas with each other, but we need to come together.
Yeah.
Because keeping everybody apart, those in a club and those in a different club, we look into ourselves as opponents. But by bringing everyone on the table, I think we have a lot of commonalities that we can build on, from the healthcare, from the non-health professionals, as well as the low-carb activists.
Very, very interesting. So we personally, I think me and Anup, Ira, we have been following Dr. Hadi also in
Yes.
Twitter, because we have been reading about all those conferences. Very nice. So I think in future, let us explore, Dr. Ansari, that how D-Life can be, can be useful in your community. In what way can we be useful in terms of education? Whether you need to, you can get back to us whether how we can be involved in some educational activity. We can do everything online also. Everything is open.
Yes.
If we want, we can have some modules, we can have some discussions, we can have some question and answer sessions. What do you think about this?
Wallahi, we need to, I used to answer this question into 5 areas. We need to do something in training. We need to do something in research. You have a lot of expertise in research. We need to revisit what is in the media about low carb and address the good, sound, evidence-based science on low carb, and make a great content, simple, easy for the people to understand. We can do some initiatives. From my background as a school health director general at one stage, I think that we need to do some interventions in a very small community. Let's talk about a workplace or a hospital or a university or a college. And we try to address the education, the training, try to make awareness among this group. And these initiatives are a showcase that over 6 months or 1 year, we look into people before and after. And this showpiece can be very much conclusive and convincing for decision makers to see the results on the ground. And the need, again, we need also to look into the other initiatives other than that, which is research. Of course, we need to do something together. But going back to what Saad Al-Hadi is doing, recently I was having good correspondence with Dr. Abdul Hadi and the group to look into low carb from the community aspect. As what I did in walking, they didn't concentrate much on the health staff to help me convince people to walk. I went to the community per se, directly, and I could collect a lot of activists. Ali Al-Khuzayim is one of them. And those people probably, even if they don't have any medical background, can help in walking. Again, what is my advice to you and to Abdul Hadi is to look into the community aspect of low carb. And now I was corresponding with Abdul Hadi to look into how to advocate, how to empower, how to go to the law-making people and the decision makers and try to convince them. Because in one aspect, we can look into low carb at the clinical part, where I used to coach and train and advise and take people from NCDs to remission on individual base. On the other aspect, I can manage, this is what I am very much interested in, the community aspect of low carb, and try to not to make it something like a mystery. Low carb is not mystification, it is simplification. And I'm trying to look into that because people wanted to eat as far as their ancestors were eating. And this is very simple message. It doesn't go into calories, it doesn't go into the mitochondria, what is happening in the mitochondria. we need to say when to eat, how to eat, what to eat.
What to eat?
And these simple messages can be given to almost everybody in the community. And probably we can do something together to copy the message of walking into low carb and do a great success in this area.
Very, very interesting. And so please let us know how, as a community, we can help. We do have a lot of expertise in the low carb front. And even we have a lot of research papers from the world over. We have gathered that in our community. All those can be always retrieved. And in general, how to help different population. Like what the expertise of D Life is, since we are working in India, which is a predominantly vegetarian country, we know how to deal with various groups. So whether it is vegetarians or non-vegetarians who are
Yes,
meat
salam.
eaters. So it is something which an expertise which we gathered, and because in India the cuisine varies from every 100 kilometers, so we are so used to adjusting the all the foods to suit various communities. So it is comparatively
Yes,
easier for us to deal with many of the cases. So I think we can we can work on this, and please let
sure.
us know how we can do, and we'll be so happy to do this. And your walking community, your walking stories are so so thrilling that probably one day we will also join you in walking that 21
One-
kilometer half marathon walking. So today morning I had walked 13 kilometers today morning.
13.
Yeah, 13
MashaAllah.
kilometers. So I do
Great,
once a week.
great.
I walk 13 kilometers. Otherwise it is 4, 5, 6 kilometers what I do. But
A
on
day.
Sundays or Saturdays, so it
Yeah.
is around 13 kilometers is what
Halas,
I do.
we will add you to our competition.
Yeah, you can always walk.
And
So
great. This is great.
thank you. I think this is one podcast which is very unique in the sense. Usually we keep discussing low carb, keto, or carnivore type, but this is one program where we have been discussing intermittent walking coupled with intermittent fasting, which is something which is very, very easier to do for
Two simple
most of us. Very
issues.
simple,
Yeah.
with the non-controversial. Both are really
Both are
non-controversial,
not controversial.
and we are so happy to we're happy, thrilled, also surprised to know that these two simple measures can really get people off insulins also. It really opens up a lot of learning for us also, because we are also too focused on the low carb. Very nice.
Yes, and,
So
and I think the low carb community should also look into physical activity as a
yeah,
very great adjuvant to the process. Really, walking makes a lot of difference, not only through reducing through consumption of calories, but also on building habits, controlling the appetite, making a quality sleep easier. And I look into walking and a very strong adjuvant to each and every nutritional intervention, because it is not only reducing calories but consuming calories, but also changing the habit of the people, the concentration, the meditation that we do while we walk. We come to ourselves closer, and this will be a very good addition to any type of regime or nutritional intervention.
fine, thanks. And we in D Life, we will also, we'll also look into the aspect of, community development, specifically at the knowledge investment and partnership from D Life. So we will get back to you. Maybe we'll have a separate meeting and see how we can really we can have a
Sure,
synergy. I will say that
I
it's only a synergy between both of us is what we can do.
really,
We can we can
in
learn a
my
lot
case,
from you.
in our case, we went into the grassroots.
Yeah.
People now, simple people from different backgrounds, are helping. Religious people, teachers, engineers, businessmen. If each and everyone, when he is convinced with walking, he adds a lot to the initiative, and they not only adding, but also adding creative ideas to make walking more propagated to the community.
So we'll work on this 5 points on which you really
Inshallah.
are working on. So we'll throw open for questions. Anyone has any question to ask, they can ask. I give the option of people can unmute and they can actually speak if they want. Anyone wants to speak anything or ask anything, tell anything, they can as well go ahead now.
I need to thank everybody of you and Anup, probably if he's with us.
He's
I
there,
need
he's here, he's here.
to hear his comments.
Yeah, I'm here. I'm here.
You can open your video, Anup.
Sure.
Anup.
Yeah.
Yeah.
Yes, I know.
Yeah. Actually, last in the end, Shashi mentioned, about so to say synergistic alliance or cooperation in those 5 areas that you also highlighted. And I think they were also, in a private meeting, it was discussed already by Ira, I think. So those are the points where we would like to actively, be involved in whatever format that works in your country.
Please.
And that's it.
Thank you.
Fine. Anyone wants to ask anything? Ira, you want to comment anything? Sneh, you asked a question. Yeah, Ira.
Yeah, thank you, Dr. Ansari, for this wonderful podcast. And I think we are quite in line with each other's thoughts. I quite respect the fact that you are looking at the larger community development and not just a one-on-one. I think that is what is going to make a difference in a place like Saudi Arabia, or in your region where low carb is not that popular. But I do think that ketogenic diet is picking up now in your area, and there have been a few people who have successfully done that, and they are spreading the message.
Yes.
So you're already into intermittent fasting and walking as a protocol. We can, as Shashi said and Anup said, we can definitely work towards building a partnership in how we can train and impart knowledge in the community. So I
Yes.
think that's what my message is.
There's a lot
Yes.
of learning opportunity for each other,
Yes.
is what I see. We can learn
Yeah.
from what is being happening there, and they can probably also learn something about what we are doing here. I think
Yeah.
it's going to be really
And
fine.
let me add that we can categorize the community into groups. We need
Mhm.
to do low carb, sort of ketogenics diet for women, for school children,
Mhm.
for the body building
Community.
community, as well as the older people. Again, they need to look into low
Mhm.
carb. And each and every community has their own peculiarities and
Mhm.
their special concerns. And when we categorize the community into smaller groups, then we can control what we do with this category in a different way, because people are learning with different backgrounds, with different means, with different methods. And this is what I used to do in our initiatives. We used to look into a problem, a category, or a space or a place where we can do the changes that we want to do on that particular group, because talking to the community at large will dilute the message. But concentrating on people in the above 40 and talk to them about muscle building and these things beside ketogenic, because we used to lose something like 1% of our muscle mass as we grow every year above 40, and these issues of particularity for the older groups. Then the message is try to categorize the community into smaller groups where you do your initiative for each group alone.
I think
Fine.
in terms of knowledge exchange and partnership, as I had last proposed, and I think you should consider this instead of also targeting the community. The knowledge investment could also be the D-Life course that we have. And I sincerely wanted to, talk about this because it is empowering one person to empower 10 more people. So in that respect also, we can give it a thought.
Yes, and I really remember over of your guests is a lawyer by training. He was a speaker in your metabolic health conference on India last month.
Antonio
Antonio
Martinez.
Martinez. And this is what will make the difference, because we will target the same issue from different angles and different
Yes.
point of view.
Yes.
Nice. Anything else? Anyone? People are making comment. Fine, very good. So people are appreciating that Very simple technique like walking and intermittent
Walking
fasting
and
is
then
coming.
fasting, yes,
Very,
as
very, very
simple as
simple.
that. But
I
now
think
I'm trying to add more emphasis on sleep
sleep.
and muscle building for those who are above
Right.
40. These are very important. Of course, you cannot take away any one of those lifestyle changes because one of them can spoil the whole story if it
Yeah.
is like sleep, of course, if you are
Yeah.
not sleeping well. But for the community, walking and intermittent fasting.
Very good. So I think if there are no questions, we can end the session.
Can I ask a question,
Yeah,
please?
Sneha, please ask. Please ask.
Dr. Ansari, given people's love for carbohydrates, how do you even broach the subject of a low carb lifestyle concept with your patients or your community that you work with?
Well, a very big question and very important question. We used to give people tools. One of them is to use stories for people who stopped sugar, absolutely, what differences they noticed. We used to find some short videos for the social media to emphasize on the value of stopping sugar. One of the issues is also to give the people the story of sugar. The story of sugar is only 200 years in the planet. It's only 200 years, something like that. We used to live without sugars for more than millions of years or thousands of years. Also, another issue that we want to let people know what they expect when they stop consuming sugar. Sometimes people will experience some headache. Some of them will look into craving or something of any mood disturbances. And if people know what to expect when they stop sugar, they need to be ready for that and not to go back for consumption of sugar. Another issue is that we used to talk to people on what is the relationship between sugar and different health problem. How does it affect high blood pressure? How does it affect fatty liver disease? How does it cause coronary artery disease by increasing triglycerides and going to the arteries, sorry, to occlude the coronaries. The issue is to try to make sugar issue into smaller pieces and give it dose by dose for people to know from stories, from the what is sugar, why sugar, who was able to stop sugar, how about blue zones in everywhere in the planet living without sugars. And the message is to try to make a big bolus into smaller pieces so people can swallow.
Very good, very good. So have you found the need to set up any food de-addiction groups based on people's addiction of carbohydrates?
No, not to my knowledge. In my country, it is nothing that I could have heard about. But you can tell us what can you do in such a group?
Well, it's from what I've been learning, carbohydrates are very addictive. In fact, sometimes more
Sure.
addictive than alcohol, and smoking, but more so
Sure.
alcohol and drugs, So I just wondered,
Yeah.
just wanted to gauge how well the low carb community who has agreed to take the concept on is actually retaining the knowledge and seeing the change in their health, and so keeping on with that lifestyle that rather than going back to their original food habit.
Let me think with you of incorporating this issue with the already formulated working groups. In our country, there are more than 200 working groups. Next Friday, I'll be flying to Jeddah on the Red Sea coast to join Jeddah Walkers. And this could be incorporated in one of the groups to do a lot of training for the group, give them a good content about sugar, do some and look into what can they do together while walking? Because, and I also add walking, because usually walking is taking place in groups, 2 people, 3 people, they share experience while they are walking. And probably this could be a good idea if we can communicate later and see what can you suggest more to emphasize on يعني trying to build the habit of good food in smaller groups, or a healthy eating in a smaller group. And those smaller group can teach us a lot of conclusions to take to other people.
Yes, absolutely. Thank you. It's been really great listening to you.
Thank you, Sneh. Anyone else wants to ask any question, make any comment? Fine. I think so. We will end the session. Dr. Ansari, thank you very much for coming and talking to us on walking. Anyone wants to add something?
Sorry for interruption.
Yeah,
this is Ali.
Mr. Ali, yeah.
Actually, I have a question.
Allah
يمسيك بالخير يا دكتور.
أهلا.
I have a question, but after I will tell you a brief of my experience on how to fight against the diabetic.
Yeah.
First of all, I stopped sugar, oils, which is carbohydrated, or what you call it?
Hydrogenate.
Hydrogenate. Plus carbohydrate, which is a bread or whatever these things. Start walking. Alhamdulillah, I start in a few kilometers until I increased my walking until I reached up to 10 kilometers a day. Now, of course, after 7 years of starting this program, I stopped, alhamdulillah, under the medication, of course, under the medical observation. Now, because of some injuries happened to me last week in Al-Ammariya during hiking, I cannot walk. Now, it may take almost a month, maybe, or more than, I don't know exactly. Do you think my blood sugar will be increased? Plus, I'm the same program. I'm not eating those things at all. And I add, which I read in Doctor, it's about the eggs, how it will decrease the sugar. I think I read it in X account of Dr. I forgot the one beside you. Sorry, I forgot his name.
Dr. Shashi?
Yes, Dr. Shashi. I read it in Twitter. He said that eggs can also, there is a studies that can decrease the blood sugar. But my question is,
yes.
Now I am not walking at all. I'm crawling at home, really. Using wheelchair also. So do you think that my blood sugar will be increased on this amount, in this moments or days?
Yes.
Shukran. Thanks a lot.
Shashi, can you answer the question of the eggs?
See, eggs, what I have seen is eggs do not raise the blood sugar. There is no significant rise in blood sugar after taking eggs.
This is good news for you, Ali.
You can always see, you can test your blood sugar now, have 3, 4, 5 eggs, and then test afterward. There is hardly any movement.
Yes, salam. And regarding the other,
not even 5 milligram per deciliter is what we have seen. And even if he's not walking now, and if he's on a low carbohydrate diet, if he's eating primarily animal origin proteins and on non-starchy or low starch vegetables, his blood sugar can be under control. If he walks, it is an additional benefit.
Sure. Yes. And you can, Ali, you can keep your heart pumping any way other than walking. You might do some resistance training. You can move the parts that can be moved. I don't know what sort of injury you are having, but you can move your trunk, you can move your arms, you can do weightlifting, you can, because what I wanted to add is that physiotherapist should be able to help you to move anyhow with whatever you can move in order to keep your heart pumping at least 30 minutes until you pass this stage of inability to walk. But you cannot, I don't forgive you, Ya Ali, if you keep sitting all the time because of the injury. You can do many things to keep your heart pumping, and because this is very important to keep in shape and not to add more kgs to your weight.
Shashi, if I can remind you,
I know.
soleus muscles you
I
are
was just
posting
coming to that. I was
yeah.
just coming to it. Just 2 days back, I had posted that soleus muscle exercise.
Yes, salam.
That you can just sit and keep raising your heel, just like in India, that old tailoring machine, how they will do, keep raising your heels. If you do that
calf
50
muscle.
times, calf muscle, or
Yes.
that muscle below the calf, that soleus muscle is the only muscle in the body which doesn't use much of glycogen, but it pulls blood sugar, or it oxidizes the sugar to get energy. And if my experience goes is, with couple of my cases, when they do this before meal, and if they do 50 repetitions with that, blood sugar pre-meal goes down by around 15 to 20 points approximately.
Yes. And of
Yes,
course, resistant training will add positively
That is
to
going
the
to.
issue.
So upper arm, if upper body you can always use, there is no issue.
it is called second heart of body.
Yeah, exactly. Salam. This is true.
Yeah, there is a question. Vineet, you can unmute and ask if you want.
Hi, Dr. Salih.
Hello.
Yeah, I just wanted your thoughts on, potential benefits of going on a fasted walks, like going on a 16th hour of your fast or 18th hour of your fast. Because
At what age
personally,
you are talking?
sorry,
What age?
any age, like I am 43 and sometimes I go on a long fasted walks. I feel lots of mental clarity. So wanted to know your thoughts, like what
Thank
benefits
you.
you can get.
Yes, we are Muslims. We as Muslims, we used to fast Ramadan, and I used to walk at the last hour of the day before we go for breaking our fast. And I have been doing this since more than 15 years by now. And I usually ask people to do walking on a fasted stage, because at that time, no blood flow will go to the gut, gastrointestinal tract, and you will save a lot of blood for your muscles, for your brain. You in the same time, you will be finding a lot of clarity of thinking. Meditation will be much more of benefit compared to people who walk after a meal. And in my case, I think that when I used to add some 2-3 kgs on my weight, I wait for Ramadan, where I do this something like 6 to 8 kilometers of walking on a fasted stage. But mind you, I should remind that couldn't be done for everyone who is not used to walk. Don't start with this good, a lot of walking on a fasting stage if you are not used to do it gradually, because I need to build the fitness. I need to build the ability to burn, the ability to keep doing with lower energy. Of course, as a keto person, that when you need some time to transform your source of energy from glucose to ketones. It will take some time, not only over the 15 hours or 18 hours. It also, you need to train your liver, train your muscles, train your heart, train your brain to use ketones. And this doesn't take place over a shorter period. We need to make it on a gradual basis, but ultimately you can reach to a walking for 10 kilometers after 24 or even 48 hours of fasting. But this takes time until you will be able, and this will be of greater benefit for your health.
Okay. Thank you so much.
Fine, I think so. Any more questions? Then we can end. So again, Dr. Ansari, thank you. What is it? Fine. So thank you very much for coming and sharing with us your knowledge of, a very simple remedy of go out and walk and do intermittent fasting. And
Exactly.
possibly low carb can be one more synergistic factor which can be added to it. And it's a great work which you are doing in your country by taking out a very simple measure. And thank you for coming and sharing knowledge with us. And thank you for being one of the big fan of Metabolic Health Conference.
Sure.
You have been a silent fan, which we never noticed. We noticed only after the conference got over that Dr. Ansari is over there posting all our conference, posting all the small quotes he has picked up so painstakingly, watching all the sessions and in educating people. You have a big fan following in Twitter X, and I think people will surely benefit. I thank you once again for sharing your knowledge, and we look forward for continued collaboration in this space. Thank you.
Thank you. You are really enlightening the whole region about low carb and ketogenic diet, and you are doing a great hope for people in our countries who used to say that when I am diabetic, this is the end of the story. Now we are giving hope to people to do to live healthier than before diabetes was diagnosed.
In fact, I will add that once you're diagnosed with diabetes, you have an opportunity to start afresh. And that is what me and Anup we have done, or even Arun Kumar. We have started a new life post getting diagnosed as a diabetes. Thank you.
For us, diabetes was a blessing in disguise.
Yes, and I think especially for people who passed the age of 50 or 60, you are giving a new life for someone with new dimensions, new areas to explore, hiking, trekking, walking, using all youth people used to use for enjoyment, and you can do it the same way that a very young people can do.
Thank you. So I'll stop.
Thank you.